Hi, and welcome to the virtual in-service for June 2020. As you know, COVID-19 has caused us to cancel several in-services, so we are happy to bring you this virtual in-service. Our agenda for today includes the Rights, Abuse, and Neglect training, a COVID-19 update, and our annual MassMutual presentation. We're going to go ahead and jump right into our Rights, Abuse, and Neglect training. And so there are several protections that are in place for the individuals that we serve. There are federal and state regulations that govern the operations of the ICF, and they're very clear on how an agency is to protect the individuals that it supports. We're going to review those guidelines and help you understand your responsibilities and actions as an employee of Will Foster. So some of the rights that our individuals have, we're going to go through several of those. One is that we are to inform each resident or guardian of the person's medical condition, developmental and behavioral status, risks of treatment, and of the right to refuse treatment. Another is to allow and encourage individuals to exercise their rights as clients of the facilities, citizens of the United States, including the right to file a complaint and the right to due process. Also, we are to allow each person to manage their financial affairs and to teach them to do so to the extent of their capabilities. So this is a part of active treatment in the ICF. So a good example of this is when you take someone out to eat, the individual should have the opportunity to do the money transaction with the cashier. Or when you are shopping with someone, actively talk to them about how much money they have to spend and work with the person to figure out what all he or she can buy. We are also to ensure that clients are free from unnecessary drugs and physical restraints and are provided active treatment to reduce dependency on drugs and physical restraints. As a team, we have to find the least restrictive way to work with people with challenging behaviors. If medication is used to alter a mood or a physical restraint is needed, a process is completed to have these things approved and added to a person's plan. Once these restrictions are added, active treatment is developed to decrease the restrictions over time. We are to provide each client with the opportunity for personal privacy, and then ensure privacy during treatment and care of personal needs. So if you're assisting someone with personal care, curtains should always be pulled and doors shut. If you enter a room, knock first and do not move past a pulled curtain if it's not needed. If someone requests alone time or privacy, that should be. Ensure that clients are not compelled to work for the facility. We cannot have someone who we support complete job responsibilities of staff. Now, many individuals do enjoy helping out and may even have it in their plan to do certain chores as part of their active treatment. So this is not what we're referring to here. We are to ensure clients the opportunity to send and receive unopened mail. If someone needs assistance in opening their mail, you can help them. If the person does not necessarily want your help, you can let a coworker know that that person may need some assistance too. We are to ensure that clients have access to telephones with privacy for incoming and outgoing calls, except as contraindicated by their plan. If someone wants privacy with a phone call, we really must allow that. Many people are going to need assistance with phone calls, and they're going to need you close by to help answer any questions from the person on the other end. So please be aware of this and be willing to help. And then we are to ensure clients the opportunity to participate in social, religious, and community group activities. Please remember that we're all working with adults who have the right of choice in their activities from day to day. And the last one we're going to talk about is that each client is dressed in his or her own clothing each and every day. So part of the requirements are that we must develop and implement written policies and procedures that prohibit mistreatment, neglect, or abuse of individuals. Staff of this facility must not use physical, verbal, sexual, or psychological abuse or punishment. The next is psychological abuse, so humiliation, harassment, threats of punishment, or any other acts that could cause psychological harm. So an example of humiliation, did you urinate on yourself? Do you really have to use the bathroom again? You just went. Or you smell really bad. Or even you really make a mess when you eat. Any of these could be seen as humiliating. Threats of punishment. If you keep yelling, you're going to have to go to your room. Now, this person may really have to go to their room per their approved behavior intervention, but it should never be used as a threat. Another one is, I'm going to tell your mom if you keep doing that, or if you don't eat, you can't go outside today. Again, we need to remember that these are adults who have choices and that we need to treat them as we would be treated. Next is sexual abuse. This is abuse in regard to coercion, physical force, or taking advantage of a person with developmental disabilities or a minor. Neglect, it's the absence or lack of services necessary to maintain the health and welfare of an individual. And then exploitation is improper use of a client's abilities or resources for personal gain. This includes their belongings. So if they had an iPad and you wanted to use the iPad, taking that away from them and using it for your own personal gain would be considered exploitation. So what are the signs of abuse and neglect? So we've got a few listed here as some examples. So sudden or unusual change in mood or behavior, reluctance to speak to staff, to speak in a staff member's presence, unexplained injuries, malnutrition or dehydration, signs of restraints, and then depression and or anxiety. Now, although all of these can be signs of abuse or neglect, some can also be signs of an illness. So remember, always report changes in a person to the nurse on duty. So how do restrictions fit into this? So each restriction of an individual's rights has to go through a process. So there is a process with the team and with a committee to approve these and document what the need is, and that it's an approved process for a restriction. So unauthorized or unapproved restrictions can be considered abuse because you're taking the right of that individual away. Examples would be removing someone's personal belongings, restricting them to a certain area, or turning off their electric wheelchair or taking it out of gear. Remember, you would want to have conversations and ask, is it okay to move this personal belonging to this other area? Or do you want to go to your bedroom? If not, where do you want to go? Or is it okay if I put your wheelchair in gear while I adjust you? Remember, those conversations and that communication is crucial to what we do. So what does the law say? The law says that staff must not punish an individual by withholding food or hydration that contributes to a nutritionally adequate diet. It says that the facility must prohibit the employment of people with a conviction or prior employment history of child or client abuse, neglect, or mistreatment. We must ensure that all allegations of mistreatment, neglect, or abuse, as well as injuries of unknown sources, are reported immediately to the administrator or to other officials in accordance with state law. And the facility must have evidence that all alleged violations are investigated thoroughly and must prevent further potential abuse while the investigation is in progress. The results of all investigations must be reported to the administrator or designated representative or to other officials in accordance with state law within 5 working days of the incident. And if the alleged violation is verified, appropriate corrective action must be taken. So we here at Wendell Foster have an investigation process, and this is the basics of all programs, not just the ICF. So we ask that all violations be reported, if any observed or suspected abuse or neglect. Report that to someone in management who will in turn report it to the appropriate vice president, etc. You can also report these things directly to Human Resources at any time. The suspected employee involved is going to be removed from contact with individuals during the course of the investigation. The investigations have to be completed thoroughly within 5 days of the report. And Wendell Foster has a zero tolerance for abuse and neglect of individuals that we support. Other important details, we are to ensure the individual's safety at all times. We also treat the allegation and the investigation confidentially. And then the investigator is going to obtain written statements from all witnesses or involved parties. So if you were asked to write a statement, what do you put in your statement? You're going to answer the following questions: who, what, when, where, and how. So for the who were the employees involved? Who was the individuals involved? Who were the other people that may have seen, heard, or witnessed it? And who did you report it to? For the what exactly happened? What was said or done that made you feel that it was abusive or neglectful? And what did you do to intervene? The when, this is when we want details on when it occurred. When was the date and time of day that it happened? Were other activities going on that's going to help you remember or trigger those things? When did you report it? Where exactly was the person when it happened? Where was the individual sitting, laying, standing? Where did the incident start and end? And then how did the person abuse or neglect the individual? How did the individual react? How did you intervene to keep the individual safe? And how did you report it? Now, to summarize what we've discussed, Wendell Foster has a zero tolerance for abuse and neglect of those that receive our supports. We are to help protect those we support by watching out for physical, verbal, sexual, and psychological abuse. It is your responsibility to report abuse or neglect ASAP if you should ever witness it to a member of management. And then when you are doing a statement, you are always going to answer the who, what, when, where, and how. Okay, now we're going to move on to a COVID-19 update. As you are aware, we have made many changes over the last several months so that we could ensure the safety of the individuals we support and of our employees. And so we want to continue having that conversation and ensuring that we are preventing the spread of COVID-19 at all costs. So we want to have a conversation about what you can do and what Wendell Foster is doing to do so. So what can you do to combat COVID-19? So you've probably heard this a million times, but you're going to hear it another time. Wash your hands often. Wash your hands with soap and water for at least 20 seconds, especially if you've been in a public place or after blowing your nose, coughing, or sneezing. If you don't have soap and water available, hand sanitizer that contains at least 60% alcohol is sufficient. And then you're going to avoid touching your eyes, nose, and mouth with your unwashed hands, as this is how germs enter your body. Avoid close contact with people who are sick, even inside your home. That's 6 feet of distancing. You're going to maintain distance between yourself and other people outside of your home. Remember that there are some people who are asymptomatic that may be able to spread the virus. So you're going to stay at least 6 feet away, which is about 2 arms length from other people. And then keeping distance from others is especially important for people who are high risk. You're going to cover your mouth and nose with a cloth face cover when you're around others. So you can spread COVID-19 to others even if you don't feel sick. So wear a cloth face cover when you go out in public, so to the grocery store. Cloth face coverings should not be placed on anyone under the age of 2, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. This is a reason that a majority of our individuals do not wear masks unless they have requested one. The cloth face mask is meant to protect other people in case you are infected yourself. Okay? This says do not use a face mask meant for a healthcare worker. That is true if you are not in the healthcare setting, if you're in one of the areas of our facility where you do not provide healthcare services. And then remember that you want to continue to keep 6 feet between yourself and others. That cloth face cover is not a substitute for social distance. You want to cover coughs and sneezes. If you are around others and you don't have a face covering, remember to always cover your mouth and nose with a tissue if you cough and sneeze, or use the inside of your elbow. You're going to throw those tissues away and then immediately wash your hands or use hand sanitizer with at least 60% alcohol. You want to clean and disinfect frequently touched surfaces daily. We are doing that multiple times a day here. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, etc. If surfaces are dirty, you're going to clean them. So first use a detergent or soap and water prior to disinfecting, and then use a household disinfectant. And then you want to monitor your own personal health. So be alert for symptoms. Watch for fever, cough, shortness of breath, and other symptoms of COVID-19. This is especially important if you're running essential errands, coming to work, etc. in places where it may be difficult to keep that physical distance of 6 feet. You want to take your temperature if symptoms develop. So don't take your temperature within 30 minutes of exercising or take medications that could lower your temperature because that could show an inaccurate read. But you want to be monitoring your temperature. And then also follow CDC guidelines if symptoms develop. So what is Wendell Foster doing to combat COVID-19? So as you know, employees are assessed for signs, symptoms, and temperature checks before being allowed to work every shift that they are scheduled. Employees are required to wear a face mask when they're in shared spaces, such as hallways, bathrooms, etc. Employees are required to practice social distancing except where job duties prevent. So if you are providing daily living activities to an individual we support, you may have to get closer than 6 feet to them. That's acceptable. That's understandable. However, once you finish that, let's go ahead and move back 6 feet so that we can try to practice that social distancing. We have closed the cottages to essential staff only. And then we have visitor limitations in other areas, such as the SCL homes. And then we have asked that only essential business be conducted in most of the other business. So only enter those buildings if you need to conduct business or perform job duties in those areas. And then we are continuing the increase in our environmental cleaning. We have continued that. So what are next steps? So as a reminder, you're going to practice good hand hygiene and you're going to use the appropriate PPE. We want you to be cognizant of your own health, so be aware. Report any signs of respiratory illness to your supervisor. If you are sick, please do not attend work. We want you to support preventative initiatives and policies. And then we do ask that you watch for updates as they are available. So report any issues or concerns to a supervisor or to one of the Healthy at Work officers. We have 2 Healthy at Work officers here at Wendell Foster. The first is Kelly Turnham, the Chief Program Officer, and the second is Blair Gammon, Vice President of Human Resources.
Hello everyone, this is Ryan McDaniel with EM Ford, and we help with Wendell Foster's retirement plan. I wanted to take a few moments to discuss the plan and go over some of the benefits of participating in the plan. Wendell Foster offers one of the best retirement plans I've seen. Currently, Wendell Foster matches contributions dollar for dollar up to 3%. There's also a non-elective contribution of 2% just for being a full-time employee. Within the plan, there is the option to have your contributions go in pre-tax or after-tax. If you have questions about this or would like to know more, please let me know. As a reminder, loans are not allowed on this plan. Here is a simple example of the benefit of contributing to the Wendell Foster retirement plan. In this example, I'll show someone contributing 3% pre-tax. If this employee earns $10 an hour and works 40 hours per week, their weekly pay would be $400 before taxes and insurance. If this employee contributes 3% to the retirement plan, $12 of the $400 would go to the retirement plan. Wendell Foster matches dollar for dollar up to 3%, so they would contribute $12 on this employee's behalf. Also, the employee is owed a non-elective contribution of 2%, or $8. All said and done, this employee's retirement account would have a total weekly contribution of $32, $12 of that being the employee's money. Remember, don't pass up free money. You can access your account by going to MassMutual's RetireSmart website at www.retiresmart.com or by downloading the RetireSmart app through the Apple App Store or Google Play. During these uncertain times, I want to make sure that all of your retirement questions are answered. To set up a time to discuss your Wendell Foster retirement plan or to answer whatever questions you may have, feel free to send me an email at rmcdaniel@emford.com or give me a call at 270-926-2806. Thank you.
Again, as Ryan said, We are offering virtual one-on-ones with Ian Ford, so if you would like to discuss your retirement account, please reach out to Ryan McDaniel at rmcdaniel@ianford.com or 270-926-2806. Thank you very much for listening to this training today. Please take the quiz associated with this training and turn it in to your supervisor. The due date for completion is Tuesday, June the 30th. Have a good day.